Pindai, good morning. First up, I mean, the whole of them, 13,000 nurses, have actually been fired by the government?
Yes, very true, Braden. About 13,000 nurses, which were being represented by the Zimbabwe National Association of Nurses, have been fired, and the government says they offered them about $17 million during the talks. You know, they started their strike on Monday, and today is supposed to be the third day. So they've been engaging with the government. So what happened is that Vice President General Constantino Chiwenga, who was responsible for the talks between the Zimbabwe National Association of Nurses and the government, released a statement last night saying they've been fired because they have refused the government offer.
Now, the strike has been affecting the health sector. It's not just the nurses. I mean, the doctors were also on strike. And how are they being treated?
Right. The doctor went on a month-long strike last month, which ended about a week ago. And the nurses are saying that they were also being mistreated, and they feel that the government was ill-treating them. So they decided also to go on strike. And so what I can say is that just a week after the doctors have stopped their strike, the nurses entered. And right now, what Chiwenga said, General Chiwenga, Vice President, said they are going to recall the retired nurses, the unemployed nurses. But what we are understanding is that there are just less than 2,000 nurses who are unemployed, and they are not enough to serve the hospitals and also the retired ones.
What was the main reason for Chiwenga? What did he give? What did he say last night when he announced that they are firing the nurses? I mean, they'd reached a stalemate in the talks. What was the government's main reason, Pindai?
Right. According to Vice President Chiwenga, he says that they've engaged the nurses. They tried by all means to offer them, but they refused. But when I spoke to some senior members of the Zimbabwe National Nurses Association, they said that they feel the money which they were not offered, they were offered by the government is not enough. Therefore, their members are still suffering, and they feel that they will continue with the strike. They also said that, they responded saying that despite being fired, they believe that the government is still working on their complaints, and they don't believe they have been fired. So the government gave a reason that they refused the offer of 17 million, therefore they are fired. But the nurses are saying the money is not enough, they need more.
What about the patients? What is the government saying? Who's going to look after the patients now? I mean, all your nursing professionals you fired, 13,000 of them. How is the government thinking is going to look after patients?
Yes, that's a very big problem, Braden, because what is happening when I visited the hospitals yesterday and on Monday, the situation is very pathetic. You know, patients are not being attended to. Only student nurses were working, but most hospitals, they've actually closed departments, their departments. And the situation is very pathetic, but the government insisted that these unemployed nurses will go and work on the situation with the retired nurses. But what we understand is that these nurses are also inexperienced, because these are the nurses which are coming from college, from training, and they are the ones who are going to be put in place, and they are just less than 2,000 from my understanding.
Okay. Now, the doctors' salaries have been increased, their allowances have been increased, but the nurses have got really nothing. Does this really put Zimbabwe's health sector in a crisis, Pindai? And what is the public generally saying, especially after last night's news that those 13,000 nurses have been fired?
Yes, very true. As I mentioned, that the situation is very pathetic. The hospitals, you know, during the strike by the doctors, some hospital departments, government hospitals, also closed, and currently have also closed. So the Zimbabwe health sector has been crippled, Braden, and people are afraid that the situation is going to be worse. You know, the teachers also have released a statement. The Progressive Teachers Union President Tarakavasira Jo, you remember, teachers marched just before the holiday because currently the schools are on holiday, and they said when the schools opens in May, they are not going back to work. So they've released a statement right now saying that they support the move by nurses, and they also criticize the government move that they fire nurses. They said they will support nurses. So the situation in hospitals in the Zimbabwe health sector is pathetic, Braden.
Thank you very much. Pindai Dube, eNCA's correspondent in Zimbabwe.